patient needs different component of blood. Right blood to the right patient at the right time. Those who are platelet counts are very low and there is a bleeding due to platelet deficiencies, there we will have to give them platelet concentrates, not a whole blood. Similarly, when the patient is coming to the casualty with hematemesis and melena, we will have to give them with fresh frozen plasma rather than a unit of whole blood. So when we are going for the component therapy, we can find out that a proper unit of blood which is collected from a single donor, how many patients are benefited.
Baxter made this possible. Not only did Baxter make blood banking possible with the introduction of the first sterile vacuum blood collection and storage unit in 1939, it also made this possible, the component therapy. The therapy where the patient is given just the kind of transfusion that is required and all in complete safety.
Transfusion therapy's business of Baxter deals with collection, processing, separation, purification and transfusion of blood and its components. The business provides the component support to various critical ill patients in the hospital sector, say hemophilia care, thalassemia care, cancers, stem cell transplantations, dengue fever or any other surgical or non-surgical event. The key emphasis of this business is to ensure that there is a optimal and rational use of blood by the user, because as you all know, blood cannot be manufactured outside the body and you always need healthy donors.
In 1948, Baxter introduced the Blood Pack plastic blood collection container system, which for the first time enabled blood to be separated into its components within a closed system. This paved the way for blood component therapy, providing patients with just the blood components they required and allowing a unit of whole blood to serve more patients.
We have about 50% market share in the segment of automation, name it CS Plus machines, Amicus blood cell separators, Alex machines, OptiPresses and the likes. It's not about providing just the products, it's about providing the technology that aids better collection and storage of components. It aids knowledge enhancement, training of the medical lab technologists and blood center staff to be able to efficiently process the blood and its components.
Baxter continues to focus on enhancing the safety and availability of blood supply through advanced technologies. Today, Baxter's products are widely used by hospitals, blood banks and plasma collection centers throughout the globe to collect and process blood components for therapeutic use.
Every one of us talk about the safety of the blood and blood products, but the safety of the person is provided by the Baxter by introducing hematite to us. And we are looking forward for more such devices for the advancement of transfusion therapy in India.
We are known as true partners with the customers. You just name any blood center, any hospital in the country and we are their best partners. Our professionals stand shoulder to shoulder with the clinical team of the hospital in saving lives of the patients. So it's not just selling, it's more about a passion wherein you actually work closely with the customers, save human lives and pay back to society in a nice, gentle way.